Bienvenidos a este Explanations 2A, donde vamos a hablar acerca de una pregunta que todas las pacientes tienen, de si es suficiente levantarlos con implantes, o sea, si el implante va a hacer toda la chamba, o si necesitamos una mastopexia. Entonces, we're going to talk about the need of a mastopexia or if the implant is good enough to lift the breast. So that's a very important question, and that's a very common question that all the patients have. Did you have it?
What's funny is that I did not have that question because I only knew about implants. I didn't know about the lift. Maybe I knew like people get breast reduction surgeries, but in my mind, the only way to kind of fill out what I had lost after nursing 3 children was with an implant. And you were the one who introduced me to the concept of a lift. And you had some really interesting charts that showed, positions of things relative to your shoulders or whatever. And you helped me see that the results that I wanted would be best done with a lift. And then I think I said something like, come on, I want a little something.
A little more. So
but it was really helpful the way that you explained these options, because I don't think I knew that that was an option. And you also explained why, if it were just an implant, the natural forces of gravity would mean that there was more down low. And I don't know who wants that.
Exactly. That's very important. Most of the patients think that an implant is good enough to lift the breast. And let me tell you something. Most of the cases is not. There are very few patients when this is a good option, or they are not the majority, okay? Because when you breastfeed, what you are going to see is that the upper pole of your breast is completely empty. That is called pseudotosis, okay? And most of the patients think, okay, it's just the upper pole. So if you put an implant, that will be enough, right? Right. Just in patients who have a good quality of skin, that's very important, no stria, thick dermis, and the distance between the clavicles and the nipple is less than 20 centimeters. If you don't take these measurements, you cannot decide the better option for the patient. Also, I mentioned in my previous videos, one very important measurement is between the inframammary fold and the nipple under max traction. So when I have a patient in a video conference that she wants to come to have the surgery, it is really important that she understands that I cannot take that measure online, okay? I need to pull the nipple and measure under max traction the distance between the nipple and the inframammary fold. And if that distance is more than 10 centimeters, I'm sorry, you need a breast lift. That I think was your case. I remember the case, and I will show you some before and afters. When I measured that distance was like 11 centimeters. So I explained, if we don't perform a breast lift, you won't have a good result. Because let's use the logic. If the amount of breastfeeding, if the size of the breast itself was enough to get the breast full, what do you think about an implant? Obviously, the implant weights. Obviously, the implant will pull the skin. So what can you expect? It's very common sense. You have to use the logic, right?
I think something that I have discovered in my journey is I breastfed, I had vaginal childbirth. I thought of myself as like, my body is very natural. And when I did the abdominoplasty, my goal was very much returning my strength. I had a hard time like sitting up straight, or I think you once measured, like my abdominal muscles were so far apart. When it came time for the breasts, it was almost a surprise to me that me, who like nursed so freely publicly, would think about getting implants. That didn't jive with my sense of self or my community. And I think something that you brought was this caution that people who get implants shouldn't get huge ones. And I was like, of course I'm not getting huge implants. Like, nah, that's not me. And so it was actually perfect. Your caution against like someone who automatically thinks they should have huge implants versus my like, oh, is this even, I think maybe I'm going to get implants. And it was so helpful that you were like, exactly, we need to measure about, we're talking about circumference, we are doing measurements, we are doing calculations, we're also having a sense of creativity and proportion with the rest of the body. And that was so helpful to me. I didn't need to get huge implants. He didn't want to put in huge implants necessarily. And it felt like this really easy and evidence-based meeting of where it should be. And so, for example, I think a lot of people online are like, how many cc's? I really don't know how many cc's because you were doing things more about diameter. And I think about, projection and symmetry. But there are all these forums where people talk about how many cc's they can get, and it looks like this on her and this on her. No, this needs to be absolutely customized with someone you trust. And that was what you were able to do, was you were able to customize your recommendation that I should have a lift and a small implant, and that those two things would achieve my goals and would be safe and would look nice and would heal and have a result for decades. You know, he really does think in terms of more than a decade, which was important to me.
Exactly. The time is very important. So you mentioned a very important second point, because there are some patients that they don't want to get implants, that only want to get a breast lift. This is the other pole of the patients who want to lift their breasts. They come and they say, I don't want anything strange to my body, so I really don't want implants. Can you get a breast lift? And the answer is yes. I really, really recommend that if you don't want any type of implants or whatever, you cannot use them. That's very important. But you have to know, and this is very important, that the only way to fill the upper pole of the breasts, it will be only with an implant. We have managed to make a lot of type of surgeries, the Ribeiro, try to pull the tissue up and try to stay there. Let me tell you something. That won't last. Not about a year. If the tissue has fallen, you cannot lift it, okay? You need to get rid of it, okay? And the fill of the upper pole would be with an implant. And that's another very important point. What type of implant? We already talked about the importance of use smaller implants because of the tissue, because of the integrity of the inframammary fold. But one thing that I think is very important is the projection of the implant. If you want a breast lift, my recommendation will be to use a cooking implant. What is this? It's an implant that have a very little projection, because let me tell you something. With the MASTOPEXIA, I can do the projection because you have tissue, okay? But what I cannot do is the upper pole filling. So this will help with the upper pole filling, and the MASTOPEXIA will help with the projection. If you use some big projection of the implant, you are going to be pulling the skin to the front, and that will cause bad scarring, that will cause boobs will fall again, and that will cause a lot of stuff. I don't know if you know this, Maggie, but in the US, the most sued surgery is the in legal terms, is the breast augmentation with MASTOPEXIA. Due to the bad scarring, the exposure of the implant, so that's very important for you to know. So please remind that you need this type of implant. In the case of patients that don't need a breast lift, I always tell them, we need to use more projection. If we're not going to make a MASTOPEXIA, we're going to use just implants, we have to use more projection. So that's the way we play it. We need to plan. We need to plan ahead. We need to plan ahead of time. So that's very important.
I think the point is that all the advice that you give is personalized. It is, of course, informed by all of these other best practices and latest research, but I don't know why anyone would take the advice of some online surgeon or some forum over very individualized advice from someone who has done so many of these, but also only does the right procedure with the right patient. And I think the point is that if you come to a doctor saying, I want this, and they just say, sure, here you go, let's do it, you're not choosing a great doctor. You want someone who is adding information, who's informing your choice, and who is customizing all of those measurements, all of the sizes of the diameter and volume. And you have to remember who the expert is here. You might be the expert of your own body and have your preferences. As Illich said, some people don't want an implant, but his information and your preferences should work together to come up with the ideal recommendation that you then decide if you want to act on, and he's then prepared to deliver.
Exactly. You have to hear your surgeon. And let me add you a final thing. There are some cases that the patients have the bad, the worst quality of skin, a lot of stria, they don't have any tissue at all, and they want to have this surgery. I recommend 2 stages. There are few, yes, there are few, but please listen to the surgeon if he or she recommends 2 stages. Because we're planning ahead, the surgeons know best. So, espero que les haya gustado, que les haya quedado muy claro. Hablamos de quiénes son candidatas a una mastopexia sin implantes, quiénes se le levantan solo con implantes, y de por favor escuchar a tu cirujano y acudir a una consulta. Hay muchas medidas que solo podemos ver en físico y que las consultas online para muchos pacientes extranjeros siempre dejo como quizás este vaya a ser el plan, pero esto se puede modificar cuando llegues, cuando te revise, cuando te toque, porque ahí puede cambiar el plan. Entonces, es muy importante todos estos puntos que tocamos. Espero que les haya gustado nuestro 2A.
And dose.